we have all heard the name multiple sclerosis, or MIS, a lot. It is a complex disease that attacks the nervous system of the body. That is, the most complicated part of the body. This complexity has caused it to show different symptoms. It can upset the balance, sometimes become so severe that it takes away the ability to walk or weakens the eye, for example, to the point of blindness. We can mention the severity of MS symptoms and complications in vision, balance, hand and leg tremors, pain, dizziness, inability to speak, etc. The complications of this disease directly affect the affected person's psyche, problems like stress, anxiety, and depression. It is believed that this disease, like many other diseases such as diabetes and high blood pressure, presents itself differently in each patient and is very complex. Even doctors may struggle to understand. The symptoms of this disease vary so much that no two people will have the same symptoms. Therefore, doctors evaluate the severity of the disease before prescribing any medication. Despite significant advancements in various fields of science, in 2024, multiple sclerosis remains a mystery to the medical community, and doctors are still unsure why it affects some people. According to experts, there are approximately 3 million people worldwide suffering from this particular disease. Although it can cause several issues in the body, it does not result in the death of the person and is not fatal. Medical science has not been able to identify the cause of the disease, but they understand how it impacts the body. Nerve attacks characterize it and can be quite painful. Multiple sclerosis, MS, is when the immune system attacks the myelin sheath covering the nerves. The myelin sheath acts as a nerve protective coating, similar to the plastic coating on an electric wire. When a person experiences an MS attack, the myelin sheath is destroyed, leaving the nerves exposed and vulnerable. This can cause various symptoms depending on which nerves are affected. The question that arises is what causes the attack on myelin. Although there are several theories, scientists are not yet certain about the exact cause. In the past, scientists believed that a virus known as Epstein-Barr, also called EBV coronavirus, was responsible for the attack. There were other theories, but after extensive research, the EBV theory has been confirmed to be the most probable cause. It is important to note that the Epstein-Barr virus is different from the coronavirus or AIDS. Epstein-Barr virus EBV exists in the body of 95% of people. However, less than 0.5% of people who have this virus end up developing multiple sclerosis, MS. Scientists have thus focused on people with MS to understand what causes this harmless virus to become destructive in their bodies. After years of research, scientists have realized that a previously believed theory about a certain disease was incorrect. They have discovered that the immune system of the person's body identifies a particular virus as an enemy and attempts to destroy it. But in doing so, it damages the body's nervous system. The researchers found that the immune system thinks the Epstein-Barr virus EBV is an enemy and tries to eliminate it. However, the strange thing is that the EBV virus in the body is similar to the myelin coat of the nerves. This similarity is the cause of the misdiagnosis by the immune system, which ends up attacking and destroying both the EBV virus and the myelin. It is a significant breakthrough in the field of medicine to have finally identified the root cause of multiple sclerosis, MS, after decades of research. With the cause of the disease now known, scientists are now working towards finding a cure for it. One of the latest discoveries in this regard is to weaken the immune system for a brief period, which is the most effective way to treat the disease. This can be achieved by using a controlled steroid that temporarily reduces the activity of the immune system. This steroid reduces the damage of this disease. Scientists are focusing on the principle of eliminating this virus in the body in general, and their theory is on making a kind of vaccine. But you agree that making this vaccine is more complicated than making other vaccines. Among the most important and first symptoms of MS, the following can be mentioned: memory loss and weakness. Inability to concentrate, speaking, and language problems are common disorders as a result of Mrs. disease progression. Of course, many times it can be one of the first symptoms of multiple sclerosis. Sexual disorders. Sexual disorders are one of the most common disorders in patients with MEMS in severe stages. This condition, which is an unpreventable complication most of the time, is considered one of the symptoms of multiple sclerosis. Dizziness. Patients with misation have difficulty moving straight. This imbalance in the control of movements usually affects a person with the progress of the disease and the destruction of nerve cells. This is why many people with MS need crutches to walk. Double vision. Double vision, or vision disorders, occurs due to the attack of MS disease on the nervous system and the effect on the optic nerve, and is considered one of the symptoms of MS disease. Numbness of fingers, numbness, and persistent numbness, usually involving the face, arms, and legs, are symptoms of MS. Damage and destruction of nerve cells in the brain and spinal cord cause this condition. Numbness and murmuring can harm a person in an attack at first. Legs are the most common part of the body for this condition to occur. Weakness and muscle cramps. Spasms and muscle cramps are very annoying symptoms of MS. These spasms are usually painful and occur in the body's extremities, such as the hands and feet, and disappear after a few minutes. Impaired control of urine and stool. Urinary and fecal incontinence is not far from expected in MS. Approximately 80 of MS patients have difficulty controlling their urine and stool. These people usually suffer from the feeling of frequent and sudden urination. Another annoying problem in these people is persistent diarrhea and impaired bowel control, lethargy, and depression. Suffering from an annoying disease like MS, in addition to physical damage, can be a tool for mental torture. Many people with MS report feeling depressed, irritable, and mood swings as one of their common problems. Factors that increase the risk of multiple sclerosis. Age. MS can happen at any age, but it most often occurs in people between the ages of 15 and 60. Gender. Women are about twice as likely to develop multiple sclerosis. Family history. If one of your parents or siblings has MS, you are at increased risk of developing the disease. Certain infections with viruses, including Epstein-Barr, which causes infectious mononucleosis, increase the risk of developing the disease. Whether MS is most common in countries with temperate climates, including Canada, the northern United States, New Zealand, southeastern Australia, and Europe. Smoking. Smokers have a higher risk of developing this disease. Today, many drugs have been developed to slow down the disease process and allow the affected person to live a normal life with these drugs, hoping for the day when the vaccine will be ready and this disease will be completely eradicated.